number 10 is from Surat, Gujarat again. Trust hospitals doing substandard treatment at very low cost, and many private practitioners also under some Rahat Dar Manav Seva banner do the same. How to deal with this? Patient only sees the treatment from price point of view, not all the patients, but majority of them. They don't understand the complexity of treatment, and we also fail to educate them as most of them are uneducated. This kind of practices harms in two ways. First, lowering the charges. Second, substandard treatment, which eventually fail, and the patient trust also fails in the treatment. When they come to us, again, they believe in the kind of treatment of work and want only extraction. I know that is also positive in a sense that they will go for some sort of prosthesis, but again, they will visit some other clinic under banner of Manav Seva or like that, and thus the cycle goes on. Uh, I don't know this dentist, maybe it was not from a community member, maybe it was from some other group. But yes, I recently went to Surat for a lecture last month, last month in May and 27th or 28th of May. I went there, and one of the organizing persons from the team made me aware of that this Manav Seva banner, which they are actually offering very low price treatments. But having said that, the solution lies in your problem itself. We also fail to educate them because most of them are uneducated. If you use the technical jargon, if you use technical language, you are not going down to their level to explain. You have to equate the tooth to a body organ, and you have to make them understand the value of it. And you have to equate the same mathematically. And you have to go down to their intellect to explain, and you can say not be very, very sophisticated in your knowledge or in your linguistic skills in the clinic. So lowering, I am not telling you to lower the skills, but everybody would have its market. You are talking of that one banner where majority patients get done. We have to understand that we have 60 to 70% similar kind of patients in India who are not getting any kind of treatment done. This Manav Seva banner may be for them, but there are another 20% in the country which are deserving or which are, say, willing to get the treatment done. And we always talk of saturation. 3 lakh dentists, official number of DCI, 3 lakh registered dentists. Out of them, 40-30% are not practicing. So, paune 2 lakh, paune 2 lakh, maybe 2 lakh, 2 lakh against 150 crores. And we bloody talk of saturation. Shame on us. I'll say shame on us. 2 lakh against 150 crore. You will still say, okay, 70% is rural India. So what? 30% is what? 50 crores. 2 lakhs against 30 crores or 50 crores. Is it still less? The problem is that we don't create enough awareness. Why? What will happen if you have times? But it does not mean that you go into that mode where you try to dishearten yourself or the patient. Explain them. Spend time with the patient. I remember in my beginning, first 2 years of practice, I was in a 10/7 clinic at the backyard of my house. Clinic opened shock ke liye, just as a hobby because I was free in the evening. Yes, clinics used to happen in those times. I started on 1st Jan 2000. I remember there is a very, you can say, poor community area called as a village Sneht in near my house, about half a kilometer. And there is a lot of population which is BPL and lives there. I did one root canal for an individual, explaining him. He had come for extraction. At that point of time in year 2000, I was charging around 800 or 700 or so. Around 250 or 300 for a composite filling at that time, 24 years back. And trust me, that one root canal to explain that, I'd spent a good amount of time explaining that. That one root canal gave me at least 100 root canals in the next 2 years from the same area, from the same set of poor people. When the patients are explained 1, 2, 3, 4, it might not, but the rest will understand. And it is just a chain process. But the thing is, your work should be good. You need to equate that. Somehow we get very technical when doing these things. We try to explain, as was the first query in the morning in 1A. I'm using a root, patients don't understand root canal and bioceramic sealer. But to hell with that, yeah. Root canals were lasting when eugenol was also used as a sealer. Now, I'm not, as I said in the morning, I'm not saying shift to eugenol. What I'm trying to say is you may be using a typical set of materials which suit you, which suit your compatibility. I'm perfectly okay with that, what you are using. But explain the same to the patient. The patient has come with pain. He needs a relief from pain, not your technicalities of a resin sealer, non-eugenol sealer, or a bioceramic sealer. He's not interested in those technicalities. We try to go in the technical way. तो इतना है, ये तो ऐसा पड़ेगा, तो महंगा पड़ेगा. We try to dictate those terms. Our way of selling is absolutely bullshit. That is where the problems happen when you don't get conversions. You don't have to equate that. You don't have to calculate it that ways. Keep a lower end procedure where I'm not saying use substandard procedure. Maybe use a non-eugenol based sealer only, which is comparatively less costly. Maybe shift to a manual root canal in such patients. That's okay if you're using rotary root canals. That's okay. Before doing rotary, you were doing manual root canals for so long, especially if you are into 10-15 years of practice. Develop an alternate way of treatment in such patients. And it is not an alternate way. Till 10 years back, it was the main way of treatment. Who was doing rotary 10 years back fully? Now people say manual root canal is shit. Manual root canal is not to be done. Similar to Maruti 800 is bullshit. 800 Alto is bullshit. 15 साल 20 साल पहले वही चलती थी. But time change, comfort and luxury comes into space and we forget the basics. If such a patient comes, develop an alternate module for that. Why that rigidity? Now we upgraded. We will not be using that. If you don't want your patient to go away, develop that alternate module. Who tells you to stick to that? And work out your costing based on that and charge accordingly in such a patient. That's okay. You don't have to say a ghatiya root canal and a badhiya root canal. Explain it. There are two ways of treatment, different materials used in both. How long lasting? Maybe this is a little more long lasting. This is less long lasting. Give them options, give them a way of working. It is we who don't make things happen. We always try to equate it because I have upgraded. Now I will never downgrade. This is not downgrading. This is creating an alternative line, to put it very simply. The rest is your choice. People will always have a choice. Whenever you give them these things, they will continue to do it. You have to create awareness. Is it people are not aware? People are not educated. Who do you expect them to educate? Google? Google is already educating them. Sometimes in a wrong way, sometimes in a good way. People search it. Average price of zirconia. They come across 13 to 15,000 and we are bloody charging 6,000-7,000 for a zirconia. Who's to blame them? Google is charging them, telling them on the right path. We do the reverse. And then people say our clinics are not profitable. Who's to blame for that? You. People are not aware. People are not educated. Who's to make them aware? You. Whenever you pinpoint a finger at someone, 3 are pointing at you. Remember that. I told you in the morning, I'm going to throw 2 bombs at you. Whether you like it or not. You like my mindset, accept it. Accept the solution I'm giving you. If you don't like the mindset, my mindset or my solutions, I'm pretty much okay with it. I'm happy with it. I'm giving my viewpoint. And that is an unbiased one. Many patients want to undergo treatment, but as they belong to lower middle class, they are unable to finance their treatment. They don't want to take loan. What can be done for them? I already told you. But to tell you very, very simply, lower middle class is one of the best paying classes. They'll never cheat on you. They'll have the reservations about sometimes getting an expensive treatment done. But for the need-based treatment, they will always figure out a way. They will always figure out a way. It is we, the more, you can say, able guys or more enabled guys who are not able to do that. But they'll figure out a way. I remember one of the colleagues asking me this question long time back. Sir, I'm doing a root canal and a crown. My average charges are 9 to 10,000 with a, you can say, good root canal rotary done and maybe a PFM crown done from a good branded lab, 8 to 9 to 10,000 rupees. Now, as the patient is about to leave, you have told them 3-4 cavities which are almost root canals or need a similar kind of treatment. Now, if I give them the budget, their budget would be around about 30-35,000. Sir, that patient is earning 25,000 only. How can even I give him that budget? Said, you create a need. They'll figure out a way. वो डाका डाले, चोरी करे, उनकी problem है. Because people will feel bad. डॉक्टर के पास इतनी सिटिंग दिया मैंने, but the doctor did not tell me कि मेरे और भी दांतों में सेम करने वाला है treatment. That I visited doctor so many times, there was so many similar kind of teeth. Why was I not made aware of this thing? Whether I want to get it done or not is a separate question. But why was not I told? That is, there lies the answer for you. Many doctors do free consultation and x-rays. So patients, when visiting us, demand free consultation and x-ray. How to deal with them? The simple thing is, have printed in your waiting area. Consultation fee is this much. If you don't have a receptionist, have that printed. If you have a receptionist, tell the receptionist to convey the charges first. Let them be filtered out at the first step. The problem with us is that we tend to believe that whosoever walks in our clinic is our patient. I'm sorry, that is a wrong attitude. An ideal conversion ratio anyways is 7.2 out of 10. If you tend to still believe that जो आ गया कुछ तो देके जाए, this is not अंदाज अपना अपना where crime master Gogoi saying आया हूं कुछ तो लेकर ही जाऊंगा. It's not that. It is not a Bollywood film. Be realistic. If the patient wants to be filtered at the first step, trust me, I have a very simple ideology. If a patient can't afford my consultation fees, he can't afford me also. I don't want such a patient. That's okay. I can't please all. If the patient says देखने के भी पैसे लगेंगे, yes, देखने के भी पैसे लगेंगे. बात करना हमने तो सिर्फ पूछना था, पूछने के भी पैसे लगेंगे. No problem. I'll make up a mind whether to pay or not. Their choice. If they are filtered at the first step, best of luck. Best of luck or good luck for you. Don't want such patients. I hope you get your answer.